The number of tests completed has been going up as well, but it looks like some people are being forced to wait hours to get in. Let's bring in our Erica Natividad, who's looking into that for us today. Erica, what can you tell us?
Melissa, for the past week at least, the lineups outside of some assessment centers in Toronto have stretched around the block. Some people saying they've been waiting 2 to 4 hours to get in and get tested. Right now I'm outside of Toronto Western Hospital, where you can see the lineup right now is actually quite lengthy, and it's been this way for most of the day, stretching at one point all the way down to Nassau. Now these wait times are causing frustration for many, some of them just walking away altogether.
I figured it would be so easy and that it would be, in and out, efficient, and then it wasn't.
On Tuesday afternoon, Danielle D'Amico and her partner were experiencing some symptoms of COVID-19. They arrived at Mount Sinai Hospital's assessment center to get tested, only to learn that they closed at noon. She says she asked staff where else they could go.
And she said, well, other hospitals don't like when we send other people there, so we essentially had to figure it out on our own.
They ended up walking to the testing center at Women's College Hospital, where there was already a massive lineup.
I had asked the nurse, how long is this line going to take? And she had told me that it was about 4 hours.
D'Amico says because of work obligations, they couldn't wait and ended up walking home, still wearing their masks and keeping their distance. On social media, multiple users with similar stories. This user tweeting, "Giving up on the COVID line. The place will be closed before I get to the front." And another saying, "Michael Guerin was supposed to be open for COVID assessment until 8 p.m., but line was closed at 3:30. I got in, but 3-hour wait."
It's not entirely clear what's driving it, but we certainly know that there's a lot of people who perhaps may have had some exposures over the long weekend, or who just want to test before they send their kids back to school, or might just want to test before they go back to work. Those may be driving those longer lines, but it's not entirely clear. I think it's extremely important to remember that people who should get a diagnostic test are those who have symptoms of COVID-19, or people who might have been exposed to COVID-19. People who really don't have any signs or symptoms of COVID-19, and in addition to that, don't have any real or obvious exposures to the infection, are very, very, very low risk for this infection. And there's just a very low utility for those individuals to get a diagnostic test.
Now, Danielle, who we did speak to in that piece, says she woke up the next day feeling better, and she's feeling fine now, but she's still taking some safety precautions to protect the people around her. She is around older people in her family. Now, we did reach out to the province, or staff with the province, to ask them about the long lineups. They said they would get back to us with more information, but we have not received a response.